Hey guys, if you made it to this video, we're on video 4 of my Myths Around Laser Therapy video series. If you made it this far with me, thank you so much for spending the time watching. I really am grateful. I didn't expect half the views on some of these videos that they've been getting. So thank you for the comments. It really kind of helps me know that this information is being useful for you all. So this video I want to talk about dosing for our lasers. So dosing is quite simply the amount of energy that we need to achieve a response in our patients. It's no different to a vet doctor, prescribing any medication and needing to calculate what dose that patient needs to have an effective treatment, essentially. So very, very important. And something we need to make sure we get right, otherwise we're not going to dose the tissue properly to get a response in our patients. So the dose rate for laser is joules per centimetre square. Watts is our radiance. So joules per centimetre square, and it is simply how many joules do we need, how large is our area that we're covering, and then times it by that amount to get our total energy that we need. Now, if you look in kind of all the various places that will give you different dose rates for laser, they will probably be a little bit different. Mostly the same, but a little bit different depending. And there's different reasons for that. We very much still need to do a lot of research around dose rates, but we often have obviously different patient characteristics that will influence our dose rate. Have they got long fur, short fur, a lot of fat, a lot of muscle? Have they, kind of darker melanin, darker fur, that's going to affect absorbency? There's lots of different elements that are going to affect our dose rates, the weight of the patient, etc. So it's not quite as simple as just, saying this is how much area I've got and this is the dose rate I'm going to use. It is a little bit more complex, but the other side of it is, what device are we using as well? Are we scanning or are we doing point to point? Because the dose rates we're going to use for those are different. If you go onto the World Association of Laser Therapy website, where they have dose recommendations, they will have different recommendations depending on what type of device you're using. And this again is because you're doing it differently. So if I'm point to pointing, I'm just holding the probe in one place and I'm just dosing that area of tissue. If I'm scanning, I'm covering a much wider area of tissue. And because you've got that movement, it needs to be taken into consideration. I don't personally think there's one method that's better than the other. It depends what you're doing. And as long as you have the right dose for what you're doing. So in my mind, point to point is great if you know exactly where the lesion is. If you just want a very concentrated dose in one specific area, great, not a problem. Scanning is great if you need to cover a much larger area, and particularly if you don't know exactly what points are affected by the disease. So for example, arthritis, this can affect all of that joint space. It can affect the kind of tendon, ligaments, muscles surrounding it. So if we point to point, it can be difficult to definitely cover all of that area. Not saying it won't help, because we're still going to have an effect there. But if we want to really maximise the benefit here, by scanning, we can cover a much wider range of the tissue and just saturate as much as possible. So, my mind, one method isn't better than the other. It just entirely depends on what exactly you're trying to do, what you're trying to achieve. And obviously from a dose point of view, when we're scanning, we're going to need a higher dose than if we're doing kind of point to point. So that's again why the dose rates might be different depending on whether, what method, what type of laser you're using. And then again, add the patient characteristics in there. Now, the standard kind of dose rates roughly have been changing over the last few years as well. When I first started using lasers, I think the standard dose rate was sort of like 2 to 6 joules per centimetre square for anything superficial, and then kind of more 4 to 10 joules per centimetre square for anything kind of chronic and deep tissue. As more research has been coming out for the last few years, we've seen those dose rates increasing. Now for some kind of chronic deep tissue conditions, we're seeing more 10 to 25 joules per centimetre square, and I'm not sure if that might even kind of jump a bit higher. There was a really good paper that was published. It was a review on degenerative myelopathy, which was really quite interesting because it took some DM cases that were absolutely confirmed DM, and they all had the exact same in-house and home care plans as each other, but the biggest difference was one had had a lower dose of laser, one had had a higher dose. Now obviously there are going to be other differing things because they were two different devices, so obviously a radiance level was also going to be different, but essentially what they saw was in the lower dose group they still had an average lifespan of 12 months from DM diagnosis, so not much change there. With the higher dose group, they had an average of 36-month lifespan. That's a huge jump. Now again, it's not going to be as simple as just the dose rate here, but that was one of the biggest changes from one group to the other. And for a condition that is incredibly difficult to manage, obviously we're not going to stop the disease process, but just try and slow it down. To try and help a disease like that is huge. So again, I think we're going to see some more changes to come around dose rates as we learn more and get more confident with maybe higher dose rates. I get asked a lot, can you overdose with laser light? Now we do have kind of a bit of a curve. So obviously we get improvement, then it kind of plateaus and then kind of drops off from how effective it is. But I haven't yet come across any kind of recommendations that kind of even reach that peak. At the moment, I think we're still learning dose rates kind of on that up and still going that way. I heard once, I don't know how true it is, but you know, to achieve overdose of laser, you need to deliver sort of 50 times the amount that the average therapy laser delivers. So I think, you know, we're safe at the moment. It's something we're always obviously monitoring, but I think one of the biggest causes for not getting results is underdosing rather than overdosing. I definitely would say, you know, start off with your base rate, but if you're not seeing a result from your patient, one of the first things I do change is, you know, my dose and just increasing that dose gently to see if I can get a better result there. So that's kind of in a nutshell all about, you know, my dose and why it's important to understand the device you're using, understand if you've got preset protocols, what are the dose rates that you're using in there so that you can really understand. If you're doing scanning, if you're doing point to point and what type of patient is in front of you, all of that is going to affect the dose that you're giving. So it's not quite clear cut as just here's a dose, go and administer it. There is a bit more to it, but hopefully that it helps explain some of the elements a little bit more. My train theory, so obviously the power was our coal bucket and how big our coal bucket was. Dose is going to be how much coal we're putting into that bucket. You know, we want a bigger dose, we want more energy, we're going to chuck more coal in there. We don't want as much dose, we're going to put a little bit of coal in there. So that's how it relates to my train. Thank you again for kind of taking the time out to watch these videos. I know it's a little bit of time out your day. I was going to talk about frequency in this video as well, but I think this one's taken me a bit longer than I thought to chat. So the next video I will chat about frequency, which is a big thing for me because I'm so passionate about making sure we treat frequently enough. So stay tuned for the next video and thanks again for watching.